Hi, Assalamualaikum. Does anyone know that a certain food that we often consume are producing natural toxin? After all, there are two main natural toxins present in food of plant origin and animal origin. Excessive intake in any of them can cause serious issue. And in today's video, we will be talking about each and every natural toxin from animal origin that pose a risk to human health. What are natural toxin present in food of animal origin? What are the example of the natural toxin? How the analysis of natural toxicant and the effect of processing on the stability? And we will be talking about all of this and more by this video. So, what is the natural toxicant? Natural toxicant is a toxic which can be found in food owing to their natural occurrence. Natural poison present in food of the animal origin can be hazardous if ingested in large enough quantity. And under the natural toxin present in food of animal origin, there may be a product of metabolism or a chemical that is passed along the food chain, and poisoning due to the marine toxin occur in many parts of the world. So, what is the marine toxin? Marine toxin produced by the toxin microalgae are accumulated in shellfish, crustaceans, and finfish following their consumption. When contaminated shellfish are consumed by humans, this may cause severe intoxication of the consumer. There are 5 classifications of the marine toxin. Let's discuss them first. First, paralytic shellfish poisoning is the one of the example marine toxin, where caused by the consumption of molluscous shellfish contaminated with heterocyclic gonidine called cecitoxin. Next, neurotoxin shellfish poisoning, where caused by neurotoxin produced by the algae species dinoflagellate Caridia-bursis, where it is lethal to fish. Third, anesthetic shellfish poisoning, caused by domic acid produced by diatom of the genus Pseudonecea, which are consumed by mussels, scallop, clam, and crab. And last but not least, diarrheatic shellfish poisoning is caused by the production of acadic acid and dinoflagellate toxin in dinoflagellate genus, which are consumed by mollusks. And lastly is ciguatera fish poisoning, where caused by the dinoflagellate Gamardis toxicus, which grow on the filamentous microalgae associated with coral reef, and a consumption of the contaminated reef fish such as groupers. Hence, let's go further with two main marine toxins, which are paralytic shellfish poisoning and ciguatera fish poisoning.
Paralytic shellfish poisoning is the common form of shellfish poisoning, as deaths continue to occur with an average mortality rate for about 6% worldwide. This food poisoning occurs when you ingest bivalve shellfish such as clams, oyster, scallop, and mussels. These toxins are produced by toxic marine microalgae dinoflagellates, Alexandrium spp, Pyrodium bahamense, and Gymnodium catenatum. Other than that, crab predators, mainly xanthite crabs that consume shellfish, also may contain paralytic shellfish poisoning. So, what are the symptoms when you consume this toxin? The first effect is typically paresthesia with tingling and numbness of the tongue and lips that spread to the face, neck, fingers, and toes. The patient may also describe a feeling of dizziness, headache, nausea, and vomiting. Patients with mild to moderate poisoning, the effect resolves over 2 to 3 days, but in more severe cases, it may persist for a week. In most fatalities, deaths occur repeatedly, typically within 12 hours. The main paralytic toxins is cecitoxin, which is far more potent than tetrodotoxin. Cecitoxin and its derivative gonjaotoxins are water-soluble, heat-stable, and contain tetrahydropyridine compound, which include among the most potent neurotoxin. These toxins able to block tetrodotoxin sensitive and A+ channel, preventing this ion enter the cell and disrupt nerve conduction and result in motor and sensory nerve abnormalities. The effect of food processing on paralytic shellfish toxin. Cooking is possible in detoxifying shellfish contaminated with paralytic shellfish toxins. Since the toxins are heat stable, it may reduce the level of toxins, but it does not eliminate the danger of intoxication. If the initial level of toxin is low, cooking might reduce the toxicity effectively. Several studies have been done to determine the effect of food processing toward this toxin. From the studies, the effect of canning process on the contamination of Mediterranean cockle was observed. Boiling and sterilizing have an average of 70.6 to 77.9% and 81.8 to 90.9% reduction of toxicity. Other studies involve boiling and autoclave toward oyster. It was observed that the toxicity was reduced about 20% after boiling and less than 10% after autoclave. As for freezing, short freezing does not reduce the paralytic shellfish toxin level, but only after several months of storage at negative 20 degrees Celsius will detect the small reduction in toxicity. Analysis on paralytic shellfish poisoning. There are a lot of methods to analyze the paralytic shellfish poisoning. One of them is hydrophilic interaction liquid chromatography highlight coupled with electrospray ionization tandem mass spectrometry (MS). It was used to examine the separation of paralytic shellfish poisoning. This type of chromatography, a hydrophilic stationary phase, is combined with a mobile phase that has a high percentage organic compound. The mechanism involves hydrophilic interaction of either polar or ionic compound with a stagnant aqueous phase and ion exchange interaction. The parameters that can be examined are type and percentage of organic modifier, buffer character and concentration flow rate, column temperature and pH. The LC-MS analysis were performed in the positive ion mode with an electrospray on the API3 Plus and API165 instrument, and detection of selected ions were determined by using selected ion monitoring SIM and selected reaction monitoring SRM. The result shows that this method is able to detect all PSP toxins in a reasonable period of time within 30 minutes. This developed method of highly MS is effective as it allows the simultaneous determination of all major PSP toxins in 30 minutes analysis with high degree of selectivity. This is because the mobile phase does not use ion pair agents, which reduce the ionization efficiency and high inorganic modifier. Thus, it enhances the percentage ionization yield.
Ciguatera fish poisoning are also known as CFP. Ciguatera fish poisoning is the most frequently reported seafood toxin illness in the world, where it is estimated that 10,000 to 50,000 people per year suffer from ciguatera fish poisoning. Humans acquire this illness by eating reef fish containing the naturally occurring toxin ciguatoxins. Ciguatoxins are produced by microscopic algae called dinoflagellates in the genus Gamberdiscus, which are found attached to seaweeds, corals, and surfaces in shallow tropical and subtropical waters. Ciguatoxins are tasteless, odorless, colorless, heat stable, and stable at commercial freezing temperatures, which makes them difficult to be detected and prevented. Ciguatoxins are structurally related to the brief toxins, and they compete for the same site on the voltage-dependent sodium channel. Ciguatoxins also have a higher binding affinity for the site than brief toxins. Symptoms of ciguatera fish poisoning. Symptoms of ciguatera fish poisoning can be characterized by gastrointestinal, neurological, and cardiovascular symptoms. In addition, after the initial or acute illness, neuropsychological symptoms may also present. Gastrointestinal symptoms usually begin within 6 to 12 hours of fish consumption and resolve spontaneously within 1 to 4 days. Gastrointestinal symptoms may include nausea, vomiting, abdominal pain, and diarrhea. Next, the neurologic symptoms usually present within the first 2 days of illness. They often become prominent after the gastrointestinal symptoms. However, they may also present concurrently with gastrointestinal symptoms. The neurologic symptoms vary among patients and include paresthesias such as numbness or tingling in the hands and feet or oral region, metallic taste, sensation of loose teeth, generalized pruritus, which is itching, muscle and joint pain, headache, and dizziness. A distinctive neurologic symptom is cold allodynia. It is also referred to as hot-cold reversal, which is an alteration of temperature perception in which touching cold surfaces produces a burning sensation or a dysesthesia. Less commonly, severe central nervous system symptoms such as coma or hallucinations are also one of the neurologic symptoms. Neuropsychological symptoms. Neuropsychological symptoms, which often become apparent in the days or weeks after the initial or acute illness, include subjectively reported cognitive complaints such as confusion, reduced memory, difficulty to concentrate, depression or irritability, and anxiety. Fatigue or malaise are also one of the symptoms. Lastly, cardiac symptoms may manifest generally in the early stage of the illness. When present, they usually occur in combination with gastrointestinal and or neurologic symptoms. Cardiac symptoms often include hypotension and bradycardia, which may necessitate emergency medical care. Effect of processing on the stability of ciguatoxin. Ciguatoxin is lipid soluble, heat resistant, and not affected by freezing. Since the toxin is heat stable, cooking does not destroy the toxin, no matter how well the fish is cooked. Analysis for detection of ciguatera toxins in fish. Methods have been established for detecting ciguatoxin in fish implicated in ciguatera fish poisoning outbreaks, which the results are used to support the clinical diagnosis. The detection of ciguatoxins could be done by analyzing the fish meal remnants, whether they are raw or cooked, that are implicated in the poisoning for both species identification through DNA barcoding and molecular confirmation of ciguatoxins in the implicated fish. Some of the challenges for ciguatoxin detection and analysis in samples of fish are: first, low concentration of toxin present in the fish that pose a human health threat. Second, toxin integration in complex fish tissue matrix. And third is the diversity of potential ciguatoxin congeners found within a single sample. Based on the Food and Drug Administration, ciguatoxin fish testing procedure is conducted in an analytical laboratory setting and utilizes a two-tiered protocol involving first in vitro mouse neuroblastoma cell assay as a semi-quantitative screen for toxicity consistent with ciguatoxin mode of action. Second is liquid chromatography tandem mass spectrometry for molecular confirmation of ciguatoxin. In the first tier of ciguatoxin analysis, fish specimens are screened for voltage-gated sodium channel-specific activating effects on cell membranes as measured by cellular death. This screening procedure helps in distinguishing between toxins that activate the target voltage-gated sodium channels, such as brief toxins and ciguatoxins, versus toxins that block the target voltage-gated sodium channels, such as tetrodotoxins and saxitoxins. This procedure helps in distinguishing between the effects of sodium channel specific toxins and those with other modes of action too. In the second tier of ciguatoxin analysis, the presence of a specific ciguatoxin congener that has been identified as a regional biomarker for ciguatoxins is detected. Multiple reaction monitoring in positive ion mode is the tandem mass spectrometry technique employed to confirm the presence of a specific ciguatoxin congener. There are also other alternative analyses for ciguatoxin detection in fish, such as receptor binding assays, various liquid chromatography mass spectrometry methods, other less frequently employed assay systems, and lastly Fock methods, which may have potential utility, but studies are needed to establish the validity of these approaches.